If at any point in your pregnancy you want some advice, then please feel free to ring at any time. Our Maternity Assessment Centre opens Monday to Friday, 8 a.m. till 8 p.m. And then outside of those times, you would contact Delivery Suite. You should have the number for both of these on the front of your green notes. You also will have a contact number for your community midwife or the team that your community midwife works in. So many different options for getting advice, but to ring Maternity Assessment or Delivery Suite, you're going to be able to speak to somebody straight away. It may be that your community midwife is on leave or on a day off, or she may be in a clinic and not able to answer your query straight away. Please, please, please always give us a ring if you want some advice. Many ladies will ring and say, well, I had a little look on Google and tried to find the answer first, but actually Google doesn't know you as an individual, doesn't know your pregnancy as being unique. So a midwife is always able to give you some specific advice just for you. So please do give us a ring if you've got any concerns. So common things that you might contact Maternity Centre about. Maybe that you're concerned that your baby's movements are reduced. By this stage of your pregnancy, you will know what feels right for your baby. You will be aware of your baby's pattern, be aware of what times of day perhaps your baby is more active, maybe what activities you're doing when you feel your baby move the most. And it's about having that gut sense about what feels normal, so that if anything is outside of that pattern, something is telling you this doesn't feel quite right, something is concerning me about my baby's movements. Any concerns, please do give us a ring straight away. What we would do is, if you are over 26 to 28 weeks, we would ask you to come in, and instead of listening in for a minute like we do when you come for your antenatal appointments, we would pop you on a machine called CTG. This is 2 belts that go around your abdomen, one that monitors your baby's heart rate, the other one that picks up any tightenings or contractions you may be having. We leave you on the CTG for a period of 20 to 30 minutes, and it gives us lots of information about your baby's well-being. If the monitoring is okay after 20 to 30 minutes, we can discontinue it. It may be that we continue it for a little bit longer than this if needed. That monitoring tells us that baby is well at the minute. What it can't to do is to predict about the following day or later in that week. So if the following day you still had concerns about your baby's movements, then you would need to give us a ring and come back for a repeat monitoring. Persistent episodes of reduced fetal movements are an indication perhaps we need to do some additional screening tests to monitor your baby's well-being. So perhaps an extra scan to measure your baby's growth, the amount of water around your baby, or the blood flow through the placenta. Baby's movements are so important, and feeling that normal reassuring pattern is your baby's way of trying to tell you that all is okay. In your green notes, you should have a copy of a leaflet that looks like this. It may be in black and white and not in colour, but this leaflet gives you some really good advice about what to do and reminds you the importance of acting on any concerns straight away. Unfortunately, there are too many things out there still that say that baby's movements slow down or stop the nearer you get to your due date. And it's really important for me to tell you that this just is not true. You should feel your baby's movements in that same reassuring pattern right up until the moment your baby is born, and you will still feel movements when you are in labour and birthing your baby. So please, any concerns, come to get checked out. If you do happen to own a home Doppler, we really don't recommend that you use these. You don't necessarily know what you're listening to, and it's important that a registered practitioner does that check to check your baby's well-being. And as I've already said, listening in for a minute is not enough to reassure us that all is well if you have a concern that your baby's movements are reduced or feel different and that's concerning you. One sign that you could be going into labour might be having a little bit of diarrhoea or a loose stool. But it could be that you have a loose stool or some diarrhoea, perhaps with some nausea and vomiting, and it actually not be a sign that you're going into labour. If you do have an episode of diarrhoea and vomiting at any stage in your pregnancy, it's important to ask yourself 3 questions. The first question, do I feel well in myself? So yeah, I feel a little bit off colour, but generally I feel okay. Or actually, no, I really don't feel well. I've got quite bad abdominal pain, I maybe feel a little bit fluey and achy, and I just really don't feel very well. Second question, am I concerned about my baby's movements? Do they feel normal, or is anything concerning me? So yeah, I can feel my baby moving as normal, in that normal reassuring pattern, and I'm not concerned. Or actually, no, I'm not really feeling the baby move as much as normal. It's a little bit quieter and it's concerning me. And then thirdly, am I keeping hydrated? So even if you really don't feel like you want to eat anything, as long as you're managing to keep water down, then you will be well and baby will be well. If you're not able to keep water down and you're not able to keep hydrated, then we do want to hear from you, because it may be that you need to come in and have some medication to help you with your sickness or nausea, or you may need some IV fluids to help rehydrate you. So ask yourself those 3 questions. If the answer to any of those questions is no, so concerns about baby's movements, feeling unwell, and not able to keep fluids down, then those are all reasons that we would ask you to come in and get checked. If you feel well, if you're happy with movements and you're keeping hydrated, then you can just keep at home and see how you do. And if any of those things change, then to give us a ring and ask for some advice. And it's likely that we'll ask you to come in so that we can check you and your baby's well-being.